Hi everyone. So we woke up this morning to news from the National Center of Disease Control, that's the NCDC, that we have a reported case of coronavirus. The disease was confirmed in an Italian citizen who works in Nigeria and came in from Milan to Nigeria. So while the NCDC is embarking on a contact tracing to find out those who might have one way or another contacted him, here are a few do's and don'ts to keep us safe and healthy in this period. So here is something that we need to know about the coronavirus generally. The coronavirus is a large family of viruses that includes the Middle East Respiratory Syndrome coronavirus, that's the MERS-CoV, as well as the Severe Acute Respiratory Syndrome, or SARS as we know it. And this particular outbreak that we are having has been called the novel coronavirus, or the nCoV, because this is the first time it has been detected in humans. So the family of coronavirus are primarily zoonotic, so usually they come from animals to humans. Let's keep in mind that the major mode of transmission of the coronavirus between humans is through respiratory droplets. That's coughing, sneezing, saliva, and all of that. So here are a few tips that I would like to put out there for as many of us who are worried about the coronavirus and what to do. Number one thing that I'm going to mention is do not panic. As in, you guys, let's all calm down and, let's not panic. Let's not enter into panic mode. The coronavirus, so far, the mortality rate has been about 2%, 2.3% the last time that we checked. And of course, we are following the updates closely. It's not as terrible as the SARS virus outbreak and the Middle East Respiratory Syndrome outbreak, which had higher fatality rates. And then when you also combine or you talk about the Ebola virus disease, where the mortality rates were about 50 to 90%, I think we have seen worse. So let's not panic. The next point I'm going to talk about, wash your hands. Wash your hands. As simple as it is, washing hands is a life-saving technique. So make sure you wash your hands under running water with soap. And then, of course, make sure you do this as regularly as possible, especially when you go out, you are in contact with different surfaces, outside, inside, contacting people. Make sure that you wash your hands properly and practice good hygiene every time. You can also make use of a hand sanitizer as well. Another tip that I'm going to mention is, as much as possible, avoid clustered spaces, crowded spaces, like buses, large events, religious centers. As much as possible, make sure that you avoid those kind of spaces. All right, another tip I would like to put out there is avoid close contact with people who are sick, who might be having symptoms that might depict the coronavirus. So what this means is the NCDC has recommended that we maintain a distance of at least 1.5 meters from sick people, because when you cough, these respiratory droplets can go as far as 1.5 meters. So please, let's ensure that we maintain a safe distance from people who are coughing or who might be having symptoms that might depict coronavirus. All right, another tip that I would like to throw out here is, if you have any symptoms of cough or respiratory tract infection at this time, I would recommend that you stay at home and probably contact the NCDC to relate your symptoms. There are a lot of emergency numbers for the NCDC down on their website, so please contact them and they will tell you exactly what you need to do. But to prevent panic, please, if you are coughing, it is better you stay at home. And of course, get medical advice. Do not self-medicate. And if you are going to be going out and you have symptoms of cough, please make sure you get a face mask. All right, now this is a face mask. The face mask has two sides. The blue side, which is usually the outside part, while the white part is worn inside to face the nose and the mouth. There is also a metal strip, a metal strip right here on the top. It actually does two things. Number one is to show which side of the mask is the top side. And number two, it helps to pinch and follow the contour of your nose. and there are elastic handles which stretch over the ears to grip the mask on your face. To wear a mask, let the white side face your nose and let the metal strip be on top to follow your nose contour. Do not wear it halfway. When you need to dispose it, do not touch the mask itself. Rather, using the handles, remove it from your face and dispose it off properly. Then wash your hands. Do not wash or reuse the face mask, as this barrier may be damaged. Another tip I would like to throw out there is please do not stock up on chloroquine. Yes, there are a lot of news out there saying, stating the efficacy of chloroquine in the treatment of the coronavirus. Now, as I earlier mentioned in this video, this coronavirus is called the novel coronavirus. What this means is that we are still trying to understand the properties of this particular new type of coronavirus. So, chloroquine has not yet been officially confirmed by the World Health Organization to be efficacious in the treatment of the coronavirus. Do not abuse chloroquine at this point in time. So the next tip I would like to mention is please be careful how you sneeze, especially in public. When you're sneezing, make sure you sneeze into probably a disposable napkin or tissue, and after you do that, please dispose of those napkins and tissues and follow proper hand hygiene. That's wash your hands. And also, if you are going to be sneezing and you do not have a napkin, please make sure you sneeze into your elbow and then also follow good hand hygiene. Another tip I would like to mention again is please do not spread false information. Do not believe and spread false information. Make sure that all your news and information come from reliable sources that you can trust. You remember the episode of the Ebola virus where there was Ebola salt and water? Yes, a lot of things will be going out right now. Then lastly, the tip I want to put out there is believe in the efforts of the federal government in tackling the coronavirus through the Federal Ministry of Health. Yes, I know we all have issues with the system in Nigeria, but hey, Nigeria conquered the Ebola virus. So what is the coronavirus that we cannot conquer? Please support the medical professionals by following these tips. If this coronavirus outbreak or any virus outbreak is to be controlled, the responsibility lies with us, you and I as citizens, to ensure that we follow the right health advice and together we can defeat this coronavirus outbreak. Make sure you stay safe during this period and make sure that you stay tuned to MedBuzz for news and health updates as concerning the coronavirus outbreaks and every other outbreak going on within the West African continent.